Assalamu alaikum. So today we will try and finish lens along with cataract. Main topic is cataract. Alright. So the last time we discussed a little bit of general anatomy, how we classify cataracts, what are the important symptoms and signs of cataracts, how we will differentiate immature cataract and 3 stages of immature cataract. And we have a hypermature cataract and a hypermature cataract. And then finally we discussed a nuclear cataract as well. After that, we discussed briefly about the cataract surgeries. क्या होता है उनमें क्या नहीं होता overview क्योंकि आपने surgeries की वीडियो देखी थी and the golden formula when we're which is one of the prerequisites when we're performing the cataract surgery for ocular rehabilitation, these two things which together and after that a few complications as well. On the most two of the important complications were post-op endophthalmitis and posterior capsular. So allogeneic pearls, which is one of the types, and the second is a simple PCO. And these were treated by a YAC capsulotomy. So today we will discuss a few other cataracts and one other condition. So आज cases ही सिर्फ हमने करने हैं. Let's start with our first case. Read. MCQs में या आपको कोई कभी भी केस में नेट मिले तो always read the last line first. So you know that, so you get to know what the examiner is asking and what you want to specifically know from all this. इतनी ज़्यादा जो आपको कहानी डाली हुई है इसमें से आपके लिए क्या ज़रूरी चीज़ है. That always read the last line first. In this case, pathologic process is asked, diagnosis नहीं पूछा. In some cases you will be asked about the treatment. In some cases you will be asked about the next best step in management or the complications even. Always use the last line so you know what you're going and to conclude or deduce from all of this. So what is asked over here is the pathological process behind the initial improvement in vision. Which initial improvement? Now let's read this whole scenario. Okay, so I don't have a picture at the moment because I thought it was pretty straightforward. अगर आपने पिछला पढ़ा होगा उस समय तो आपको इसका आंसर पता होगा. So what are the important points or what are the important things which we have to note in this case scenario? क्या है कोई बताएगा? I'll highlight them now. Let's start. क्या चीजें हमें देखनी है इसके? What is important? Age. So the first thing is age. A 66-year-old gentleman. Age से क्या है? We know कि जितनी ज़्यादा age होगी, we will think कि age-related processes are involved. अभी कोई और आगे जाके देखते हैं. If we also find in that. So gentleman presents to us with gradual loss of vision. Gradual loss of vision. It's a very peculiar statement. अब हम gradual loss of vision के हमने differentials कल ही पढ़े हैं. So we know that we have to consider some things. So let's see. His ophthalmic history is insignificant again, except for the diagnosis of presbyopia. Presbyopia is an age-related thing हो जाती है. Other than that, और कोई history नहीं दी हुई. अब इस patient में ना hypertension की history है, ना diabetes की history है. We can already exclude two important differentials of loss of vision gradual, which are hypertensive retinopathy, diabetic retinopathy. वो दो कहानी से निकल जाती है क्योंकि hypertension नहीं है तो HR कैसी होगी, diabetes नहीं है तो DR कैसे होगी. We've excluded two important differentials now. चलो आगे चलते हैं. He's using bifocal glasses. Important point, all right. Reports that his near vision had gotten better initially. बड़ी अजीब सी complaint है cataract patient में कि his near vision had gotten better initially. We have to keep this in mind. IOP is 18. ठीक है? IOP normal है?
Yes.
IOP is normal. IOP की normal range is considered 18 तक ही कहते हैं, वरना जनरल रूल है कि 20 से नीचे हो तो ठीक है, तो हमें कोई immediate खतरा नहीं है glaucoma का. तो this also kind of rules out open angle glaucoma, chronic open angle glaucoma. An opacity is present on the lens. So on examination, an opacity is present on the lens. Abhi tak, what is your diagnosis till now? क्या diagnosis निकाला आपने?
Nuclear cataract.
Nuclear cataract.
Nuclear cataract. So it is the nuclear cataract. Why? Because if we go back to this last statement, which we saw in the first, the pathological process behind the initial improvement. We know that in cataracts, there are three important pathological processes. The first is hydration. The second is denaturation of proteins. And the third is sclerosis or hardening. Now we know that the first two processes, they occur in the cortex, and the last is predominant in the nucleus. So we know that an improvement in near vision. Now, presbyopia means a loss of accommodation or inability to accommodate. So a presbyopic person is also his lens cannot accommodate, so he will have hypermetropia in near vision. So it's a near vision ka issue hoga. So when he reports that his near vision has improved, it means that the power of the lens has increased. And we saw from last time that it is an initial feature of nuclear sclerosis. So the pathological process behind the initial improvement in vision is nuclear sclerosis. That is the answer to this question. कभी-कभी ये होता है कि यूएटिस काफी सीधा साधा है, but when you're giving tough professional examinations, USMLE या बाहर भी आ जाए करें, they थोड़ा सा घुमा फिरा करते हैं. They'll give you the same statement or something like this, and they've asked you for the pathological process. हो सकता है कि they will give you the diagnosis in the answers. So sometimes we read the scenario and we pick the diagnosis, but that isn't what they have asked. They've asked for the pathological process. So make sure that you read the last line first in MCQs. Okay. Let's come to this scenario. So the last line is in this clinical record, or something which the examiner wants to ask us is, what is the definitive treatment in this patient? By definitive treatment, it's meant that something which will permanently cure the symptoms and permanently cure the disease process. This is in contrast to symptomatic treatment, which only gets rid of the symptoms. So you've been asked a definitive treatment. Now let's focus back on this patient. So what are the important points in history?
Age.
Age. First is important. Age is always important. All right, middle-aged person. Age. We know that cataracts, if they're senile, they usually occur in older people. थोड़े सा है, इस age में भी हो जाते हैं, but it's a little early. Not unusual, but something which is uncommon. So let's move on. Gradual loss of vision in his right eye. Unilateral gradual loss of vision. Okay. From this alone, we know that diabetes and hypertensive retinopathy, they are causes of bilateral loss of vision. Similarly, age-related macular degeneration also causes binocular loss of vision, or gradual loss of vision. Binocular होता है, एक आंख में ज़्यादा हो सकता है दूसरे की निस्बत. One eye can have a greater deterioration of vision, but they both will have some degree. So this person has unilateral gradual vision loss of the eye. But he also has history of type 2 diabetes mellitus, for which he is prescribed metformin and insulin. Standard regimen, all right. Past history is insignificant. ठीक है, कोई ऐसी बात नहीं. This is a clue. His recent HbA1c is done a month back is 8. Normal HbA1c कितना होता है?
6 से कम.
6.5 से कम, बिल्कुल. 6.5 से कम, right? So his HbA1c is elevated, all right, elevated. So this patient has type 2 diabetes mellitus. His diabetes is not controlled by prescribed metformin and insulin. So we have a short story. So when we look at these two things, हमारे पास 3 या 4 चीजें आती हैं. हो सकता है diabetic retinopathy हो, या उसकी कोई complications हो. but that is unlikely given that this patient has gradual loss in his right eye alone. ठीक है, चलो कर लेते हैं. One thing which is peculiar, एक और मजेदार चीज आ गई. His IOP is 27 in the right eye and 18 in the left eye. ठीक है, let's absorb this for a moment. आगे पढ़ लेते हैं. This is an opacity present in the lens of the right eye shown below. The right eye is shown below and there is an opacity present in the lens. So a lens opacity in this context, it has confirmed our diagnosis that this is indeed or in fact a cataract. But it's okay, it's a cataract. Diagnosis mil gaya. Why? How can one explain this raising of IOP in the right eye, whereas the IOP in the left eye is normal? Why do you think this is happening?
Phacomorphogenic glaucoma.
Phacomorphic glaucoma. So what is phacomorphic glaucoma?
Glaucoma due to swelling of the lens.
Swelling of the lens. So in this patient, let's break down this for a moment. Right, this patient who has type 2 diabetes, he has uncontrolled diabetes mellitus, and his HbA1c is high. Now, diabetes mellitus can cause a lot of cataracts. Iska ek specific cataract bhi hota hai, which we will discuss in a little while. But it also causes an earlier appearance of the normal senile cataract. And the senile cataract, which usually occurs after the ages of 50, 55, 60, and all that, they are in patients who are suffering from diabetes mellitus, they occur a little earlier. So a cataract in a patient of diabetes, ठीक है, हमें हो सकता था he would have asked for a buzzword and all that stuff, all right. But his IOP is raised in the right eye, but it's normal in the left eye. So it means that there is a correlation between the raising of IOP in the right eye and the presence of opacity in the right eye. So this points towards a cataract which is causing a raising or increase in intraocular pressure. This is phacomorphic glaucoma. So what is the definitive treatment of phacomorphic glaucoma in this patient?
Treat the cataract.
Treat the cataract. And how will you treat this cataract?
पहले IOP कम करेंगे फिर surgery.
पहले IOP कम करेंगे फिर surgery, right? So the definitive surgery, so the definitive treatment is
Phacoemulsification.
Phacoemulsification, right? The definitive treatment is phacoemulsification because his IOP is due to the cataract, and while that cataract is also causing visual symptoms, it is also raising the IOP. Cataract pe keh diya, you will treat the patient. This is phacomorphic glaucoma, and the definitive treatment is now you will have to describe this cataract for me along with this case. Case scenario padhe. If you have been given a picture and you know that the examiner has asked what is this cataract called, and if you've seen these pictures before, आपको scenario पढ़ने की कभी-कभी जरूरत नहीं पड़ती. आपके ज़हन में उसी वक्त diagnosis बन जाता है and you just read the scenario to reaffirm or reconfirm your diagnosis. Since we're discussing it for the first time, we have to read the scenario. क्योंकि इसी तरह ही आते होते हैं. Let's analyze this case scenario. So the first thing we have is the age. Age is 36. 36 is young for a senile cataract, and 36 is borderline or almost out of the boundary कि जिसमें कोई congenital disease हो. ठीक है, तो एज आपको इस तरह एक बड़ी अच्छी डिफरेंशिएशन दे देती है between senile processes and developmental or congenital processes. So this is a middle-aged person. who presents to our ophthalmology clinic with redness, pain, and progressively diminishing vision in the left eye for 2 days. Okay, he has symptoms of redness, pain, and progressively diminishing vision in the left eye for 2 days. What does this tell us?
Acute है.
Acute process, right? This is an acute process. And if you read the next line, we can see that there is a trigger. Blunt trauma from a fist punch to the left side of his face. 6 to 7 hours before the appearance of the first symptoms. यानी कि symptoms से 7 घंटे पहले he had received punch to his face. So there's a temporal association between the occurrence of symptoms and this trigger. So we now know that these symptoms, they're appearing due to this blunt trauma. So this is his left eye. In an examination, visual acuity is reduced in the left eye and it's normal in the right eye. IOP दोनों आंखों में normal है. Now, before I show you the slit lamp examination and before we discuss which type of cataract this is, what is the diagnosis of this patient from the above history and examination? कोई differentials की list आपके ज़हन में आनी चाहिए. There are 2 to 3 things which should come into your mind. What is your diagnosis? Yes, you should consider traumatic cataract. बिल्कुल. So other than if I was चलो अभी हम visual acuity नहीं देखा, we have not seen the slit lamp examination up till now, and we have not read this last line. Last line to exclude care never. Based on the rest of this history in this examination, what do you think can be wrong? 2 or 3 things they should come into your mind.
Corneal damage.
Yes, corneal damage should come into your mind. Traumatic corneal abrasion, traumatic corneal damage. और क्या हो सकता है?
Hemorrhage.
Hemorrhage, that's good. Hemorrhage. और क्या हो सकता है?
Orbital fracture.
An orbital fracture. Yes, an orbital fracture भी हो सकता है. So these are things which can be occur due to trauma. It also includes a mild anterior uveitis as well. So blunt trauma can cause a lot of things, right? So we will discuss blunt trauma in further detail when we have our session on blunt trauma. But for now, we'll keep it simple because we know that on slit lamp examination, we can see this. So on examination, we see that everything is relatively normal. कोई इतना मसला नजर नहीं आ रहा. Ciliary congestion भी नहीं है, all that. Chamber भी थोड़ा clear है, lens भी all right. Sorry, cornea भी all right है, कोई इतना मसला नहीं है. But look at this. What is this? How will you define this shape?
Flakes.
Flakes. All right.
Flower shaped.
It's flower shaped. Okay. So this is a kind of a flower shape. You can see it's kind of a flower shaped cataract, and it's a lens opacity search cataract, right? So flower shaped cataracts, we come across 2 in ophthalmology, which are similar to flowers. Which flower does this cataract look like to you?
Sunflower.
Sunflower. All right. I'll show you a sunflower picture later. This is not like a sunflower. This large circle in the center and the petals, they radiate out like this words. So while it has petals radiating, they are pointed and there's no central thing which tells us a sunflower. दरमियान में वो कोई ऐसी चीज नहीं है. The other flower, if it's not a sunflower, there's another flower which medical sciences loves very much, and that कौन सा फूल हो सकता है? Rosette. Yes. So this is a rosette-shaped cataract. Now, typically, rosette-shaped cataract means that it's a cataract which has a branching pattern So by branching, आपको कहीं जगह किताबों में if you look closely in your books, you will find that it's a cataract going like this, even some places. इस तरह का मिलेगा आपको. It has branches or Rosette-shaped distribution. स्क्लेरोसिस स्ट्रेंथ क्या है कि वीडियो अगर किसी माइक्रो में आप में से किसी ने देखी हो तो ये Rosette-shaped पैटर्न बताता रहता है. So this is another Rosette-shaped cataract, which have some spokes and it's in the pattern of a rosette. A Rosette-shaped cataract is associated with trauma. This is an important buzzword for your MCQs which you have to remember. A Rosette-shaped cataract is also a traumatic cataract. Okay? This is a Rosette-shaped cataract or a traumatic cataract caused by trauma. So blunt trauma will have other manifestations as well. It can have Gaussian string, it can have mild anterior uveitis, etc. We will discuss them when we discuss blunt trauma. So Rosette-shaped cataract done. आगे हम आ जाते हैं इस केस पे. Let's look at this case. A 40-year-old gentleman, still a little too early for the presence of a senile cataract. So there must be something which is causing the accentuation or presence of a cataract. Right? There must be something else. Age is not the only factor in this patient's disease. So हमें age से थोड़ा बहुत ये अंदाजा लग जाता है. Gradual loss of vision in his right eye. Unilateral gradual loss of vision. We can exclude hypertensive retinopathy, diabetic retinopathy, ARMD. थोड़ा सा हम कह रहे हैं because we know that those processes are somewhat bilateral. एक आंख में नहीं होते लेकिन एक आंख में preference जरूर शो करते हैं. He has a history of type 2 diabetes mellitus. All right. Same. He is prescribed metformin and insulin. HbA1c done a month back is 9.5. Normal कितनी होती है?
Less than
6.5.
Less than 6.5, right? So there's an opacity present in the lens of the left eye shown below. What is the diagnosis? So if we अभी तक जितना अभी इस scenario में गया है, तो we can conclude that this gentleman who is a little his age is a little less for the development of a senile cataract. He presents to you with the symptoms of cataract, prime symptom, and on examination, the presence of a cataract. So the findings of the cataract, if you relate it to age, so it's not a senile cataract. So something is accentuating the formation of this cataract. Now, in the history, we've given that he has type 2 diabetes mellitus, which is literally uncontrolled. ये बंदा कोई परवाह नहीं कर रहा, नेवा खाई जा रहा है. His HbA1c is 9.5, extremely poor glycemic control. When we look at the eye of the patient, this is what we see. So you can already guess that this is a diabetic cataract. But what is the morphology of the cataract? Specific buzzword जिसके ऊपर आपको MCQs में दिमाग खपाना पड़ेगा अपना.
Snowflake.
Cataract with a
Snowflake.
snowflake appearance, right? This is a diabetic cataract with a snowflake appearance. Okay, it's relatively simple. First confusion होती है, but it's white and it appears like a snowflake. You know that snowflakes is तरह के नहीं होते. They have a strange hexagonal pattern. मुझे आज तक समझ नहीं है कि why they had to name these cataracts and मुश्किल morphology से क्यों नाम रखने होते हैं. कोई पता नहीं. Allah behtar jaane. So this is a diabetic cataract which has a snowflake appearance. We can contrast the snowflake appearance to this rosette-shaped appearance. You can see from the luster, from the color, and the pattern and the appearance. So now, अच्छा हमें पता लगा कि snowflake cataract है, it's a diabetic cataract. Cataract होता क्यों है diabetes में? Can anyone tell? It's related to biochemistry.
भाई ये
हाइपरग्लाइसीमिया
question
की
है
वजह से
Yes, hyperglycemia की
Sorbitol.
वजह से sorbitol accumulation. Who is this person? क्या नाम है इनका? Sheroz is right. Sorbitol. Okay, glycemia, hyperglycemia causes every disease by two mechanisms. Okay, the first is non-enzymatic glycosylation, and the second is uh, osmotic pressure or osmosis due to presence of sorbitol. So lens, it contains enzymes which turn glucose into sorbitol dehydrogenase, but it does not contain aldol reductase, the enzyme which turns sorbitol into the other normal glucose or fructose or whatever. This leads to the presence of an osmotically active substance in the lens, which causes the accumulation of fluid, hydration, water, intumescence, and formation of a cataract. ये अगर आपको दो चीजें याद है ना तो you will डायबिटीज में आपको पैथोलॉजी में मेडिसिन में कोई मसला नहीं होगा if you know these two things and where they occur. Okay, so a little bit of extra information. All right, snowflake cataract in diabetes. Association and buzzword है, you have to remember it. Moving on to our next case.
भाई ये question है.
Of course.
Hello.
जी पूछें.
भाई ये वाला जो आपने सिनेरियो एक्सप्लेन किया है डायबिटिक कैटरैक्ट का, इसमें ऊपर जो सिनेरियो उसमें लिखा है कि ग्रेजुअल लॉस ऑफ विजन इन राइट आई, लेकिन नीचे जो कैटरैक्ट बताया हुआ है वो लेफ्ट आई का है.
Sorry, I'm very sorry. आपने अच्छी गलती पकड़ी है मेरी. मैं जल्दी में I actually copied this scenario exactly from the first one. तो एक दो चीजें मैंने change की थी उसमें. This is the right.
सही से.
Thank you for letting me know. My bad. इस तरह की गलतियां होती हैं, पकड़ लिया करो, because sometimes it gets confusing if you don't ask it. कहानी right I discuss करो and this left it in the statement. So it was my bad. The statement was wrong. So right I जिस आंख में gradual loss है उसी में मसला हो रहा है. So let's move on to this next scenario. After दो lines आप पहले दोबारा पढ़ लें. There's an opacity present in the lens of the left eye. And what is the diagnosis? There's an opacity present in the lens. The opacity in the lens तो हमें पता लग गया क्या है. Diagnosis हमें पता लगाना है. Diagnosis, we need to know the scenario. What is the scenario? Our patient is 40 years old. Again, a little too young for a senile cataract to develop. So let's read it further. Decreased vision in his left eye. All right, left eye here, left eye here. Decreased vision in his left eye over the past week. What this tells us that this person has an acute decrease of vision in his left eye. It's not sudden, it's acute. थोड़ा आगे scenario पढ़ते हैं. We need to find this trigger, either it's infection or what is causing this acute or sudden loss, acute loss of vision, not sudden, sorry. So he reports that 1 week back he had developed sudden redness and lacrimation in the same eye for which he was taken to the ER. Now, before we move on any further, sudden redness and lacrimation. Sudden redness and lacrimation. What do these tell you? What do they point towards? A foreign body. So redness and lacrimation for which he was taken to the ER, sudden. So this is most likely a foreign body. Immediate foreign body reaction, right? Redness hai, lacrimation hai. It could be a corneal lesion, a keratitis or a corneal abrasion. Corneal abrasion भी हो सकती है. Keratitis or inflammation, it usually develops over a period of 1 day, 2 days, थोड़ा सा time लगता है. So you're thinking that there's a foreign body, all right? और ऐसे ही था. A lodged foreign body was removed from the eye and he was discharged. A lodged foreign body was removed from the eye and he was discharged. ठीक है. तो ये तब की कहानी है. This was 1 week back. Sorry, I couldn't hear you. Let me finish. मैं आगे पढ़ता हूँ. So there's an opacity present in the lens. Now let's relate all of this. What do you think is happening over there?
5 times a day.
I'm sorry, I couldn't hear you. Could you repeat that? जबकि आवाज नहीं आ रही.
Maybe while the process of removing that foreign body, it caused trauma to the lens.
Yes, that is true. It could have caused trauma to the lens. That's right. That is a possibility we need to consider. So, इसका आंसर आपको देता हूँ बाद में. इसको थोड़ा सा नीचे रख लेते हैं. So yes, something can happen while removing the foreign body. So let's just take let's say a foreign body which was taken to a lodged foreign body was removed from the eye. So if there's a lodged foreign body in the eye and it was removed, it most likely means that it was present on the surface. And when it's removed from the surface, it's unlikely that the lens may be developed. Maybe the cornea could have been damaged, IOP problem ho sakta tha, something like that. So what else could have been, what else can be the possibility in this case? Okay, one possibility is that during the removal of this lodged foreign body, we have damaged the lens somehow. What
Maybe
can
bits
be?
of the foreign body retained.
Yes,
retained in the...
exactly. Now he was discharged, okay, and we don't have any history whether an examination, a thorough examination was performed. A thorough examination meaning that a complete straighten-up examination was performed. A indirect ophthalmoscopy was performed to visualize the peripheral retina, which should be performed in a case of foreign body. Because sometimes what happens is that a part of the foreign body, it invades inside the eye and it is hidden somewhere which is not obvious. That is a possibility we have to consider. Now, when we see this eye, this is the examination. And this is the place where he said that the foreign body was present. So, if you look closely at the cataract morphology, can you guess this morphology? Because if you guess this, it's quite a lot easier. But if not, I'll give you a hint. Okay. We cannot appreciate it on the examination at the moment. But opacity present in the left eye, shown below, also has a
sunflower cataract.
yes. This is a sunflower cataract. This picture is a little vague, but generally they term sunflower cataracts which have a central opacity and then there's radiation of opacities from it. This is a sunflower cataract. What is your diagnosis?
Alcosis.
Yes. Now that is good. Now you both are correct in some sense that sunflower cataracts, they can also occur in Wilson's disease. However, this patient who has a history of foreign body trauma, and there is a suspicion that that foreign body is retained inside the eye, and there's a presence of a sunflower cataract along with Kaiser-Fleischer ring, two findings which are significantly associated or point towards copper accumulation in the eye. Our diagnosis will be chalcosis or trauma with the copper metal. That is also consistent with the history, occupation history of this patient. Now, if this were to be a patient of Wilson's disease, what would he have? He would have cirrhosis. Wilson's disease is basically a defect in ceruloplasmin, and that causes ceruloplasmin, as you all know, is important in the metabolism of bilirubin. That causes cirrhosis. If not at start, it causes hepatomegaly, and otherwise, it also causes lenticular degeneration of lenticular nuclei. Basal ganglia ke masle hote hain, so it causes movement disorders. So if the same findings were present in a patient who had cirrhosis or who had hepatic dysfunction, and he also had movement disorders or basal ganglia problems, then yes, our diagnosis would have been Wilson's disease, because Wilson's disease also presents with Kaiser-Fleischer rings, and it can also present with a sunflower cataract. However, this history trigger the sudden redness, the sudden development of a cataract. All this, it is more consistent with retained foreign body, a retained copper foreign body, i.e. chalcosis. ठीक है? तो कॉपर के साथ chalcosis के साथ कॉपर के साथ बल्कि कहना चाहिए कॉपर के साथ जो associated cataract है, that is a sunflower cataract. This is another picture of a sunflower cataract. जिसमें मैं फिर दोबारा कहता हूँ कि I don't know why they name these things the way they do. So look closely. This is the central part of the sunflower. Or the we know that there's black spots in the sunflower. These are the petals which are radiating from it. This is a sunflower cataract. It's nearly sunflower. It hasn't developed that much, but it is what it is. Quite confusing, no? So these were a few cases. बाकी हम discuss करते हैं. The session has 1 minute left. I'll end the session now and then I'll come back again. So don't go anywhere.